Welcome to the Deep Dive, where we break down complex surgical topics for the FRCS PLAST exam.
Today, we're diving into genioplasty,
We'll cover everything from anatomy and deformities.
to preoperative evaluation and surgical techniques.
You'll need a solid grasp of these concepts to ace your exam.
Let's start with the anatomy.
While several muscles are involved in this area,
Pay close attention to the mentalis.
this muscle originates from the incisor fossa and inserts into the skin of the chin.
Giving the chin its shade.
It's the most important muscle encountered during surgery.
And understanding its function is crucial for achieving natural-looking results.
And what about bony landmarks?
Which ones are particularly important for the exam?
You'll definitely need to know the mental foramen.
Think of it as a key landmark,
It's typically aligned with the pupil
the infraorbital foramen.
and the second premolar tooth.
This foramen is where the mental nerve, a branch of the inferior alveolar nerve, exits.
Damaging this nerve during surgery can lead to complications.
So remember to perform osteotomies at least 5 to 6 millimeters below the mental foramen.
Speaking of nerves, what else should we know about the nerve supply in this region?
The mental nerve is the terminal branch of the inferior alveolar nerve.
It's crucial to understand its pathway to avoid injury during surgery.
Okay, let's move on to blood supply.
What vessels do we need to be aware of?
Primarily the labial branches of the facial artery.
And the inferior alveolar artery.
The inferior alveolar artery runs alongside the inferior alveolar nerve and supplies the chin region.
Got it. Now let's talk about cephalometric points.
These are essential for analyzing chin projection and overall facial harmony.
How can we use them effectively?
Think of cephalometric points as markers on a map of the face.
We use them to assess the balance and proportions of the lower face.
Key points to remember are nasion, subspinal, supramental, pagonian, and mentum.
Can you explain how these points relate to common chin deformities?
Absolutely. These points help us differentiate between microgenia
Which is a small chin,
and macrogenia,
which is a large chin.
but to classify chin deformities more comprehensively.
We use the Gyron classification system.
This system divides deformities into 7 types based on the direction of correction needed.
Could you break down the Gyron classification system for us?
Type I is macrogenia.
Involving horizontal, vertical, or combined excess.
Type 2 is microgenia.
Characterized by horizontal, vertical, or combined deficiency.
Type 3 represents a combination of deformities.
Where one dimension is in excess and the other is deficient.
Type 4 covers asymmetries,
Then we have type V,
the witch's chin deformity.
which primarily involves soft tissue ptosis
Type 6 is pseudomacrogenia.
due to excess soft tissue,
And finally, type 7 is pseudomicrogenia.
often caused by maxillary deficiency.
So understanding the Gyron classification is crucial for deciding on the right surgical approach.
Precisely. It helps us tailor the procedure to the specific type of deformity.
Okay, let's move on to preoperative evaluation.
What are the essential elements?
A comprehensive history and physical examination are paramount,
We need to know the patient's medical history,
including any conditions like diabetes
hypertension,
or a smoking history.
as these factors can affect healing and increase the risk of complications.
Dental history is also crucial.
As pre-existing dental issues or infections can impact the outcome of genioplasty.
And how do we assess the patient's occlusion?
We use the angle classification system.
You'll need to be familiar with the different classes for the exam.
Can you give us a brief overview of the angle classes?
Angle class 1 is considered normal occlusion,
While class 2 represents retrognathia with an overjet.
and class 3 indicates prognathism with a negative overjet.
So, how does understanding the patient's occlusion guide our surgical approach?
It's crucial for determining the most appropriate treatment plan.
For instance, if a patient has significant malocclusion,
They might require orthognathic surgery in addition to or instead of genioplasty,
it's also important to obtain a history of previous orthodontic treatment.
as this can mask underlying skeletal deformities.
Good point. Now let's delve into imaging.
What do we need to assess when looking at soft tissues?
Standardized photographs, including frontal, oblique, and sagittal views, are essential.
These help us evaluate facial symmetry, lower facial height, lip competence,
The relationship between the upper and lower lips.
and any specific deformities,
We also need to assess the labiomental crease,
soft tissue pad thickness,
lower lip length.
and the presence of a witch's chin deformity, if any.
Let's break those down further, starting with facial symmetry.
What should we be looking for?
We need to identify any pre-existing asymmetries.
These could be due to subtle nerve palsies or bony abnormalities.
Asymmetries may need to be addressed during surgery for optimal aesthetic outcomes.
And what about lower facial height?
How do we determine if it's proportionate?
Ideally, the face is divided into thirds,
The distance from the glabella
which is the smooth part of the forehead between the eyebrows,
to the subnasal.
should be equal to the distance from the subnasal to the menton.
Any deviations from this ideal proportion might indicate vertical maxillary deficiency,
Decreased vertical chin height.
or a combination of both.
How do we assess lip competence during the preoperative evaluation?
Lip competence refers to whether the lips naturally rest together at rest,
Lip incompetence
or the lips don't meet natural,
can often be improved with genioplasty.
particularly osseous genioplasty.
Okay, and how do we evaluate the relationship between the upper and lower lip,
We use a reference line called Riedel's line,
which connects the most prominent points of the upper and lower lips?
ideally the pagonian.
The most projecting point of the chin.
Should touch this line,
Deviations from this ideal relationship can indicate microgenia,
macrogenia.
or excess soft tissue in the chin area.
What about the labiomental crease?
What are the ideal characteristics we should be looking for?
The labiomental crease, also known as the labiomental fold,
Should ideally be located at the junction of the upper and middle thirds of the distance,
between the stomio
which is the point where the upper and lower lips meet.
and the menton.
The ideal depth is around 4 millimeters for women and 6 millimeters for men.
What factors can influence the appearance of the labiomental crease,
A deep crease can be caused by excessive chin projection.
or prominent lower incisors,
On the other hand, a shallow crease can result from microgenia.
or lingually inclined teeth?
Both alloplastic and osseous genioplasty can be used to adjust the shape and depth of the labiomental crease.
For a more balanced and aesthetically pleasing outcome.
Moving on to the soft tissue pad.
What are we looking for there?
The soft tissue pad at the pagonian should typically be 9 to 11 millimeters thick.
It's important to palpate this both at rest and when the patient is smiling,
A thin pad can become less prominent with bony prominence.
while a thicker pad can worsen the cervicomental angle after a bony setback.
What about the lower lip?
What do we assess there?
We look at the lower lip length and any signs of eversion.
Which can deepen the labiomental fold.
And how do we recognize and address the witch's chin deformity?
The witch's chin deformity presents as soft tissue ptosis below the menton.
Exaggerating the segmental crease,
Surgical correction involves resection and repositioning of the skin.
soft tissue, and muscle.
It's important to note that augmentation can actually worsen this deformity.
So it's crucial to choose the appropriate surgical technique.
Finally, what about the cervicomental angle?
The cervicomental angle is the angle between the chin and neck.
And ideally, it should be between 105 and 120 degrees.
Procedures like segmental lipectomy
Platysmoplasty?
or resection of the anterior digastric muscle can be used to improve this angle.
Excellent. We've thoroughly covered soft tissue assessment.
Now let's move on to evaluating bony deformities.
What imaging modalities are used for this?
Cephalograms and panoramic radiographs
Also known as Panorex.
are crucial for evaluating bony deformities,
These are particularly important in secondary cases.
where a previous genioplasty has been performed, or when there's a suspicion of maxillary or mandibular imbalance.
What specific features are we looking for in these images?
We're primarily assessing the severity of chin deficiency or excess.
We also need to be vigilant about potential complications, like nerve malposition.
Or dental issues that might need to be addressed during surgery.
You mentioned maxillary or mandibular imbalance.
How do we evaluate that?
We use a method called Steiner analysis.
Which helps us understand the relationship between the skull base, maxilla, and mandible,
It involves measuring specific angles,
like SNA.
S and B,
Yeah.
to assess skeletal harmony.
Now that we've covered preoperative evaluation,
Let's move on to the surgical techniques themselves.
starting with osseous genioplasty,
Osseous genioplasty involves manipulating the bone of the chin,
making it generally more versatile than alloplastic augmentation.
which uses implants.
Osseous genioplasty allows for three-dimensional correction.
And it's particularly well suited for addressing complex deformities.
What are the specific indications for osseous genioplasty?
It's indicated for horizontal asymmetries of any magnitude.
Deficiency or excess in both the vertical and sagittal planes,
Secondary cases.
especially those following complications from implant genioplasty.
And it's frequently used as an adjunct to orthognathic surgery.
Are there any contraindications for this procedure?
Yes. Inadequate bone stock.
For example, in elderly patients,
Abnormal dentition or intraoral infections.
and patient preference against osteotomies are all contraindications.
Additionally, patients with malocclusion may require orthognathic surgery in addition to or instead of Genioplasty.
Okay. Now, you mentioned that osseous genioplasty can achieve correction in 3 dimensions.
Can you elaborate on that?
Absolutely. By strategically planning the osteotomies
We can adjust the chin's projection both horizontally and vertically.
and also address any asymmetry.
This level of control allows us to create a more balanced and harmonious facial profile.
What's important to remember about the soft tissue response to osseous genioplasty?
The soft tissue response to osseous movement varies depending on the technique used.
For both osteotomy and alloplastic augmentation.
The ratio of soft tissue movement to osseous movement is approximately 0.8 to 0.9 to 1.
However, for ostectomy,
This ratio is lower.
around 0.25 to 0.50 to 1.
Understanding this ratio is important for predicting the final soft tissue changes and achieving the desired aesthetic outcome.
Okay. So let's delve into the different types of osteotomies used in genioplasty.
What is reduction genioplasty?
Reduction genioplasty is used when there's excess vertical height or sagittal projection.
The osteotomy is angled inwardly to achieve the desired reduction.
And what about sliding genioplasty?
Sliding genioplasty is the standard procedure for addressing horizontal deficiency.
In this technique, the chin segment is advanced forward,
There's a variation called two-tier genioplasty.
which involves creating 2 segments and advancing them anteriorly.
This is typically reserved for cases of extreme sagittal or vertical deficiency.
What is jumping genioplasty?
Jumping genioplasty is a less common technique used to address minor excess in chin height,
The inferior fragment of the bone is essentially jumped over the superior segment.
creating an onlay effect.
This allows for augmentation of the anterior projection while simultaneously reducing the vertical height.
Okay. What about ostectomy?
Ostectomy involves removing a portion of bone.
And is indicated when significant height reduction is required.
And what about interpositional bone grafts?
Interpositional bone grafts
Either autologous or using materials like hydroxyapatite.
are used to add vertical length.
They're often added to an osteotomy segment that has been angled superiorly.
What is centralizing genioplasty used for?
Centralizing genioplasty is specifically designed to correct horizontal asymmetries.
This often involves using wedges of autogenous bone graft or hydroxyapatite to achieve symmetry.
Let's talk about surgical approaches and fixation methods for osseous genioplasty.
The most common approach for osseous genioplasty is intraoral.
This provides easy access for performing the osteotomy and securing fixation.
And what are the common fixation methods?
Plates and screws and sutures are all commonly used to fix the bony segment in its new position.
The choice of fixation method depends on the specific technique used and the surgeon's preference.
Excellent. Now let's shift our attention to implant genioplasty.
What are the key advantages of this technique?
Implant genioplasty is generally considered technically straightforward.
And has a relatively low complication rate.
In what situations would you choose implant genioplasty over osseous genioplasty?
Implant genioplasty is a good option for patients with mild, isolated sagittal deficiencies,
A shallow labiomental fold.
or those undergoing concomitant neck lift or facelift procedures.
It's often favored by cosmetic surgery patients due to its less invasive nature.
What are the contraindications for using implants?
Implant genioplasty is contraindicated in cases of excess horizontal deficiency,
Vertical mandibular deficiency,
mandibular asymmetry,
secondary cases with bony erosion.
and significant microgenia.
It's also relatively contraindicated in smokers and diabetics.
Let's talk about the different types of implants available,
There are several types.
including silicone
Porous polyethylene.
and custom-made implants.
Silicone implants can be either smooth or textured,
Porous polyethylene implants
like MedPore,
allow for tissue ingrowth.
which can reduce the risk of implant migration but makes removal more challenging,
Custom-made implants are designed using 3-dimensional modeling.
and can be particularly useful when multiple facial implants are required.
How do you choose between an extraoral and intraoral approach for implant placement?
The extraoral approach involves making an incision under the chin.
This allows for more precise implant placement and potentially lower rates of malposition and nerve injury.
However, it does leave a visible scar,
The intraoral approach avoids a visible scar.
but can lead to improper implant position as the surgeon doesn't have direct visualization of the pocket.
What are the various fixation methods for chin implants?
Chin implants can be secured using screws,
Sutures,
MyTech anchors,
wires,
or tissue-adhering properties of the implant itself.
in cases where no fixation is used,
Precise pocket dissection and meticulous soft tissue approximation are crucial to prevent implant migration.
it seems like proper implant position is paramount.
What are the risks associated with incorrect placement?
Absolutely. Superior positioning of the implant can lead to bone resorption,
And tooth root erosion.
while superficial placement can make the implant visible
Malleable?
and prone to irregularities.
Now, let's discuss implant removal and managing secondary cases.
What are the key considerations?
Implant removal may be necessary due to complications like infection
Malposition.
or patient dissatisfaction.
Managing secondary cases often involves replacing the implant with a smaller one and ensuring secure fixation.
Osseous genioplasty may be required to fill any soft tissue voids created by implant removal.
What about soft tissue and muscle manipulations in secondary cases?
These are often necessary to prevent complications like soft tissue ptosis
Balling of the mentalis muscle.
and fasciculations.
Botulinum toxin type A injections can be used to treat muscle fasciculations.
Let's move on to potential complications of genioplasty.
What are the most common issues?
Poor aesthetic results are, unfortunately, the most common complication.
Although overall dissatisfaction rates are relatively low.
Interestingly, studies have shown slightly higher satisfaction and self-esteem improvement rates with osseous genioplasty.
Compared to alloplastic augmentation.
What are some other complications we should be aware of?
Other complications include hematoma,
Infection,
muscular complications,
malposition,
nerve injury.
and bone erosion.
Let's break those down starting with hematoma.
What are the key features?
Hematoma formation is relatively rare and usually occurs at the lateral osteotomy site.
Simple aspiration is usually sufficient to address this complication.
What about infection?
Infection is also uncommon.
With reported rates of around 5% for implants and 3% for osseous genioplasty.
Prophylactic antibiotics covering oral flora are essential to reduce the risk.
What are the signs and symptoms of infection and how is it managed?
Infection typically presents with tissue swelling and possibly a draining fistula or sinus.
Treatment may involve local wound care
Antibiotic.
or incision and drainage of any abscesses.
Implant removal may be necessary in some cases.
What about muscular complications?
Muscular complications can arise if the mentalis muscle is not properly resuspended.
This can lead to a witch's chin deformity.
Additionally, removal of an implant can sometimes cause the surrounding capsule to contract.
Resulting in balling of the mentalis muscle
This can be addressed with capsulectomy.
and either a larger implant or osseous genioplasty.
You mentioned fasciculations earlier.
What causes those and how are they treated?
Fasciculations
Or involuntary muscle twitches,
can occur after genioplasty.
although they're not always preventable.
Botulinum toxin type A injections can be used to manage this complication.
What about implant malposition?
Malposition is more common with intraoral implant placement.
And can lead to increased rates of bone resorption.
Careful surgical technique and proper implant selection are essential to minimize this risk.
Nerve injury is a concerning complication.
What are the potential issues?
Neuropraxia.
A temporary nerve injury, often caused by retraction.
Usually resolves within a few weeks,
However, permanent nerve damage can occur.
leading to lower lip paresthesias or numbness.
Careful surgical technique is crucial to avoid injuring the mental nerve.
Finally, let's talk about bone erosion.
How often does this occur, and what are the contributing factors?
Bone erosion can occur with chin implants,
Although the rate is generally low,
around 0.1 millimeters per month.
the risk is higher if the implant is placed over the alveolar bone rather than the lower mandible.
Larger implants are also associated with greater bone erosion.
That's a lot of information to digest.
Now let's shift our focus to a critical aspect of preoperative planning for genioplasty.
Analyzing the soft tissue characteristics of the chin.
The dynamic and static chin pad analysis is crucial.
What should we be paying close attention to during our patient evaluation?
A thin chin pad
Especially when the patient smiles.
can lead to increased effacement with bony prominence
This could either be a pre-existing condition.
or a consequence of augmentation.
So what are our options for addressing this?
In these cases, burr reduction or osteotomy setback may be required to achieve a more harmonious result.
What happens if the patient has a thick chin pad?
A thick pad can create problems too.
If we perform a bony setback,
It can increase submental soft tissue fullness and worsen the cervicomental angle.
regardless of the pad thickness,
What's a crucial step to prevent complications?
fixating the mentalis muscle superiorly is absolutely essential.
This helps prevent soft tissue descent.
which can lead to an undesirable witch's chin deformity.
In secondary cases where subptosis has already occurred.
We may need to fixate the soft tissue to prevent recurrence.
Moving on to imaging for bony deformities.
What are the go-to imaging modalities?
Cephalograms and panoramic radiographs.
Also known as Panorex.
Or mainstays.
These imaging studies are indispensable for accurately assessing chin deficiency or excess.
When are these imaging studies particularly important?
They're absolutely essential for secondary cases where a previous genioplasty has been performed.
And for any patient with suspected maxillary or mandibular imbalance?
Or malocclusion.
A panoramic radiograph is particularly valuable in those situations.
What about cases where we suspect nerve malposition, issues with the teeth, or underlying pathology?
It allows us to visualize the mental nerve, the apices of the teeth.
And identify any potential bony abnormalities.
Let's delve into the relationship between occlusion and genioplasty.
What do we need to consider?
In general, patients with angle-class eye occlusion,
Which is considered normal.
can usually be managed with genioplasty alone.
However, those with angle class 2 or third malocclusion may require orthognathic surgery with or without genioplasty. So how do we assess the skeletal relationships in more detail?
We use Steiner analysis.
Which involves measuring various angles on a cephalogram.
This helps us understand the relationship between the skull base, the maxilla, and the mandible.
Can you elaborate on the key angles in Steiner analysis?
Of course.
The S&A angle.
Or Selenagine point angle.
Tells us about the relationship of the midface to the skull base.
The SMB angle.
Or Selenation B point angle.
Reveals the relationship of the mandible to the skull base.
And finally, the A and B angle.
Or a point nation B point angle.
Indicates the relationship of the midface to the mandible.
These angles provide valuable insights for surgical planning.
Let's discuss osseous genioplasty in more depth.
You mentioned earlier that it's more versatile than alloplastic augmentation.
Can you elaborate on why that is?
Absolutely.
Osseous genioplasty allows us to manipulate the bone directly.
Which gives us greater control over the final shape and projection of the chin.
Sliding genioplasty, in particular, is well suited for addressing more complex deformities.
What are the specific advantages of osseous genioplasty in those complex cases?
We can achieve correction in 3 dimensions.
Horizontal, vertical, and anteroposterior.
This level of precision is often not possible with implants.
Let's talk about the indications for osseous genioplasty.
When is this approach the preferred choice?
It's the go-to option for horizontal asymmetries of any magnitude.
Deficiencies or excesses in both the vertical and sagittal planes.
Secondary cases following implant complications.
And as an adjunct to orthognathic surgery.
Yes, patients with moderate to severe microgenia who require significant chin advancement often benefit from this approach.
What are the specific patient populations where osseous genioplasty is particularly beneficial?
We need to be cautious in patients with inadequate bone stock,
What are the key contraindications for osseous genioplasty?
such as elderly individuals
Those with active dental or intraoral infections.
and those who simply prefer to avoid osteotomies,
And as we discussed earlier, malocclusion may necessitate orthognathic surgery.
which might preclude or be combined with genioplasty.
Exactly.
Now let's dive into the different types of osteotomies used in osseous genioplasty.
Starting with reduction genioplasty.
When is reduction genioplasty indicated?
Reduction genioplasty is performed when we need to decrease the vertical height or sagittal projection of the chin.
The osteotomy is angled inwardly to achieve the desired reduction.
What's important to remember when dealing with excess vertical height of the mandible.
Keep in mind that significant excess vertical height often requires formal orthognathic procedures.
Rather than just a genioplasty.
Although a simultaneous genioplasty might be performed as part of the overall treatment plan.
Now let's move on to sliding genioplasty.
What are the key points to remember about this technique?
Sliding genioplasty is considered the standard technique for correcting horizontal deficiency of the chin.
In this procedure, the chin segment is mobilized and advanced forward.
You mentioned a variation called two-tier genioplasty.
When is that used?
Two-tier genioplasty is reserved for cases of extreme sagittal or vertical deficiency.
It involves creating 2 separate bony segments, which are then advanced anteriorly to achieve the desired correction.
You also mentioned a technique called jumping genioplasty.
Can you explain that one?
Jumping genioplasty is a less common technique used to address a minor excess in chin height.
In this procedure, the inferior fragment of the bone is repositioned superiorly and anteriorly over the superior segment.
It essentially creates an onlay effect, which augments the anterior projection while slightly reducing the vertical height.
What about ostectomy?
When is that performed?
Ostectomy involves removing a portion of the chin bone and is indicated when a significant reduction in height is required.
And what about cases where we need to add vertical length to the chin?
In those situations, we can use interpositional bone grafts
These can be either autologous bone grafts harvested from another site in the patient's body.
or synthetic materials like hydroxyapatite.
The graft is inserted between the osteotomized segments to achieve the desired increase in vertical height.
What about addressing asymmetries of the chin?
Centralizing genioplasty is the technique of choice for correcting horizontal asymmetries.
This often involves using wedges of autogenous bone graft or hydroxyapatite to achieve a symmetrical chin position.
Now let's talk about surgical approaches for osseous genioplasty.
What's the standard approach?
The most common approach is intraoral.
This involves making an incision inside the mouth, which provides excellent access to the chin bone for performing the osteotomy and securing fixation.
And what about fixation methods?
We have several options for fixating the mobilized bone segment, including plates and screws, wires, and sutures.
Now let's switch gears and delve into the world of alloplastic augmentation using implants.
What are the key advantages of this approach?
Implant genioplasty stands out for its technical simplicity and relatively low complication rate.
When is implant genioplasty the preferred option?
It's a great choice for patients with mild, isolated sagittal deficiencies
Those with a shallow labiamental fold.
and those undergoing concomitant procedures like neck lifts or facelifts.
Why is it often favored by cosmetic surgery patients?
Implant genioplasty is generally less invasive than osseous genioplasty and doesn't involve manipulating the bone directly.
This can be appealing to patients who are looking for a quicker recovery and lower risk of complications.
You mentioned that neck lift and facelift procedures can sometimes facilitate implant placement.
Can you explain why?
Absolutely.
These procedures often involve making a submental incision under the chin.
Which can be utilized for placing a chin implant simultaneously.
This streamlines the surgical process and avoids creating an additional incision.
Let's talk about the situations where implant genioplasty is contraindicated.
When should we avoid using implants?
Implant genioplasty is generally not suitable for patients with excess horizontal deficiency.
Any degree of vertical mandibular deficiency?
Mandibular asymmetry
Secondary cases with bony erosion?
or significant microgenia.
Smokers and diabetics are considered relative contraindications as they have a higher risk of complications like infection and delayed healing.
What about patients with certain medical conditions or lifestyle factors?
And as we've discussed before, patients with malocclusion may require orthognathic surgery in addition to genioplasty.
Right.
Now let's explore the different types of chin implants available.
What are the options?
There are silicone implants, porous polyethylene implants, and custom-made implants.
What are the key characteristics of silicone implants?
Silicone implants can be either smooth or textured.
They're generally well tolerated, but there's a potential for capsular contracture, which can cause implant hardening and distortion.
What about porous polyethylene implants like MedPore?
Porous polyethylene implants have interconnected pores that allow for tissue ingrowth.
This can provide greater stability and reduce the risk of implant migration.
However, if an infection occurs, removing a porous implant can be more challenging.
And what about custom-made implants?
Custom-made implants are designed using three-dimensional modeling based on the patient's specific anatomy.
They offer precise fit and are particularly useful in cases where multiple facial implants are required.
Now let's talk about surgical approaches for implant placement.
What are the two main options?
We can choose between an extraoral approach and an intraoral approach.
What are the pros and cons of each approach?
The extraoral approach involves making an incision under the chin.
This allows for precise implant placement and potentially reduces the risk of malposition and nerve injury.
However, it does leave a visible scar.
The intraoral approach avoids a visible scar as the incision is made inside the mouth.
However, it can sometimes lead to improper implant position as the surgeon doesn't have direct visualization of the pocket.
Okay.
Now let's discuss fixation methods for chin implants.
What are the various techniques?
We can secure the implant using screws, sutures, Mitek anchors, wires.
Or even relying on the tissue-adhering properties of the implant itself.
Some implants also come with tabs that can be sutured to the surrounding tissues.
What's crucial when no fixation is used?
In cases where we're not using any form of fixation, meticulous pocket dissection and precise soft tissue approximation become absolutely critical.
This helps prevent implant migration and ensures optimal positioning.
You've emphasized the importance of proper implant positions several times.
What are the specific risks associated with incorrect placement?
if the implant is positioned too superiorly.
It can lead to bone resorption and erosion of the tooth roots.
What happens if the implant is placed too superficially?
In that case, the implant might become visible or palpable through the skin.
It can also create an unnatural contour or result in irregularities. Now let's delve into implant removal and managing secondary cases.
Why might we need to remove an implant?
Implant removal might be necessary due to a variety of reasons, including infection, malposition, implant failure.
Or simply because the patient is unhappy with the aesthetic outcome?
What are the key considerations when managing secondary cases?
Managing secondary cases can be challenging and often requires a multifaceted approach.
Replacing the implant with a smaller one and ensuring adequate fixation are often necessary.
Additionally, we may need to address soft tissue and muscle issues to prevent complications like deutosis, balling, and fasciculations.
What about cases where there's a significant soft tissue void after implant removal?
Osseous genioplasty can be a valuable tool for filling the void and restoring the natural contour of the chin.
Let's talk about managing nerve injuries.
What's the typical course of neuropraxia after genioplasty,
Neuropraxia
which is a temporary nerve injury?
usually resolves within 2 to 6 weeks.
It's often caused by retraction or manipulation of the mental nerve during surgery.
What can we do to minimize the risk of nerve injury?
Limiting retraction and manipulation of the mental nerves as much as possible is crucial.
Using meticulous surgical technique and avoiding excessive force are essential for protecting these delicate structures.
Finally, let's talk about bone erosion.
How often does this occur with chin implants?
Bone erosion can occur with chin implants,
Although the rate is generally low,
around 0.1 millimeters per month.
what factors influence the rate of bone erosion?
The location of the implant plays a role,
Implants placed over the alveolar bone
which is less dense than the lower mandible.
are more likely to cause
What
erosion.
about implant size?
Larger implants are also associated with greater bone erosion. That was an incredibly thorough review of genioplasty.
Now, to wrap up this episode,
Let's emphasize some key takeaways for the FRCS PLAST exam. What are some of the high-yield points for candidates to remember?
a thorough understanding of chin anatomy, including the muscles, bony landmarks, nerve supply, and blood supply, is paramount,
Candidates should be able to identify the key cephalometric points.
and explain their significance in assessing chin projection and facial harmony.
They should also be familiar with the Guérin classification system for categorizing chin deformities.
A deep understanding of preoperative evaluation is crucial.
This includes taking a detailed history
Performing a thorough physical exam.
and ordering appropriate imaging studies like cephalograms and panoramic radiographs.
Candidates need to be able to differentiate between osseous genioplasty and implant genioplasty.
Understanding the indications, contraindications, advantages, and disadvantages of each approach.
They should be able to describe the various types of osteotomies used in osseous genioplasty.
And the different types of implant materials available.
And lastly, they need to be well-versed in the potential complications of genioplasty.
Knowing how to recognize, manage, and prevent these issues.
By mastering these key concepts, candidates will be well-equipped to tackle genioplasty questions on the FRCS PLAST exam.
Now let's shift gears and talk about some important tips and considerations to keep in mind during genioplasty procedures.
What are some things that can enhance our genioplasty results?
Combining genioplasty with other procedures can often lead to a more harmonious outcome.
For instance, segmental soft tissue procedures like liposuction
Lipectomy.
and platysmoplasty can significantly improve the cervicomental angle and enhance the overall aesthetic result.
What are some key points to remember during sliding genioplasty?
When performing a sliding genioplasty, it's crucial to maintain the integrity of the soft tissues.
During dissection,
Aiming obliquely, anteriorly, or at a right angle to the bone helps preserve a small cuff of the mentalis muscle.
this intact cuff facilitates secure soft tissue approximation during closure.
You mentioned earlier that we need to be cautious about devascularizing the bone segment during jumping genioplasty.
Can you elaborate on that?
Excess stripping of the periosteum inferiorly and posteriorly can compromise the blood supply to the lower bone segment after the osteotomy.
So it's crucial to limit the lateral exposure just enough to visualize the mental nerves.
What's a key principle to keep in mind when selecting an implant for alloplastic augmentation?
In general, alloplastic augmentation should be reserved for patients with mild to moderate chin deficiency in the sagittal plane.
And a shallow labiomental fold.
More severe deformities or those involving vertical deficiency are better addressed with osseous genioplasty.
When creating the pocket for the implant,
What's a common pitfall to avoid?
Making the pocket too large can increase the risk of implant malposition.
So it's essential to create a pocket that snugly fits the implant.
Let's discuss implant removal.
What are some of the reasons we might need to remove a chin implant?
Implant removal might be necessary due to a variety of reasons, including infection, implant failure.
Or simply because the patient is unhappy with the aesthetic outcome?
What are the key considerations when managing secondary cases after implant removal?
Managing secondary cases can be challenging and often requires a multifaceted approach.
Replacing the implant with a smaller one and ensuring adequate fixation are often necessary.
Additionally,
We may need to address soft tissue and muscle issues to prevent complications like kytosis, balling, and fasciculations.
what about cases where there's a significant soft tissue void after implant removal?
Osseous genioplasty can be a valuable tool for filling the void and restoring the natural contour of the chin.
Let's talk about managing nerve injuries.
What's the typical course of neuropraxia after genioplasty,
Neuropraxia
which is a temporary nerve injury?
usually resolves within 2 to 6 weeks.
It's often caused by retraction or manipulation of the mental nerve during surgery.
What can we do to minimize the risk of nerve injury?
Limiting retraction and manipulation of the mental nerves as much as possible is crucial.
Using meticulous surgical technique and avoiding excessive force are essential for protecting these delicate structures.
This deep dive has provided you with a comprehensive overview of genioplasty, empowering you to approach this procedure with confidence.
Remember to delve deeper into areas that pique your interest and practice applying this knowledge to clinical scenarios.
Best of luck with your exam preparation.